You sit down in therapy, maybe for the first time, and you're about to say something out loud that you've never told anyone before. What if it's something you're deeply ashamed of, or something illegal? What if you're involved in a custody battle, or you're undocumented, or you're court ordered to be there? Is it safe to tell the truth? Or are you putting yourself at risk by being totally transparent? Confidentiality is one of the most important things we promise in therapy, but it's also one of the most misunderstood. I want to talk about what confidentiality actually means, when it holds, when it breaks, and what you should know before you sit down in that therapy chair as a therapist or a client. Dear future therapist, I'm Gabriella, and welcome to my YouTube channel. I'm a master's student getting my degree in clinical mental health counseling. What does confidentiality in therapy actually mean? Because, aren't therapists supposed to be keeping all of our secrets? Confidentiality is the legal and ethical obligation of a therapist to protect what a client says in therapy. It applies to verbal disclosures, therapy notes, diagnosis, billing, everything tied to the therapeutic relationship. It's designed to create emotional safety, reduce fear, and build trust. Pretty much the whole ethical foundation of the profession. It's protected under laws like HIPAA, and it's reinforced by licensing boards and ethical codes. So, is everything we share in therapy 100% confidential? The short answer is no. There are limits to confidentiality in therapy, and these limits to confidentiality are also foundational to the profession. And it's one of the first things you learn about in a grad school program. There are situations where therapists are legally required or allowed to breach confidentiality. These include imminent risk of a client planning to unalive themselves, risk of serious harm to another person, suspected child abuse, elder abuse, or abuse of a dependent adult, court orders or subpoenas, and clinical supervision for trainees or interns. It's important to understand that within this list, there's a whole lot of nuance, and there are guidelines and systems in place to help a therapist determine whether a breach of confidentiality is absolutely necessary. For example, one important nuance is that the duty to protect is not universal. Some states legally require a therapist to warn or protect if a client makes a credible threat against another person. Other states make this optional or don't require it at all. Therapists in every state have to know their state laws, and clients deserve the right to know what those laws mean for them. And for states that don't have tear-us-off rules in place, this can create a really ethical gray area. For example, there have been situations where a therapist fails to warn or protect when a client makes a credible threat and then carries out that threat. The family or loved ones of the victims could file a lawsuit against that therapist for not warning them. But if there are no tear-us-off rules in place in that state, that lawsuit may not hold. And what if a therapist simply fails to determine whether a threat is credible or not? And how do you know for sure if breaching a client's confidentiality, creating a rupture in the relationship is worth the risk? It all gets a little complicated. And this is why, as a therapist in training, it's really important that you know what the laws are in your state. In any first session of therapy or prior to your first session, the limits to confidentiality should be transparently shared with you by your therapist. So a lot of times that will come in the form of filling out paperwork before your therapy session. Sometimes it will happen during your therapy session. And in some cases, a therapist might continuously remind you of the limits to confidentiality throughout the duration of your therapeutic relationship. But wait, there's more. Confidentiality protections aren't always applied equally. Some clients, especially those navigating systems of power or legal surveillance, are more vulnerable. This first vulnerable group that I'm going to talk about, this one actually surprised me and continues to bother me when it comes to being a mandated reporter as a therapist. Therapists are not legally mandated to disclose information about intimate partner violence between two adults. And whether or not you agree with this, that is the situation as it stands under the law. There could be exceptions to this if children or vulnerable adults are involved, or if the information is subpoenaed in divorce or custody cases. But even that level of disclosure of intimate partner violence doesn't guarantee safety or legal intervention. So to recap, the only type of abuse that therapists are mandated to report on are when it involves an elderly person, a minor, or a vulnerable adult. Another vulnerable population are undocumented clients. There's no special legal protection for immigration status in therapy, and therapy records can be used in immigration proceedings. So undocumented clients coming into therapy may have a fear of being exposed, which can significantly limit trust or even prevent them from going to therapy at all. And we've seen this with undocumented individuals throughout various aspects of the healthcare system. Given everything going on in this country with undocumented people right now, this could be a whole other episode unto itself. The next vulnerable population are clients in custody disputes, because once again, therapy notes can be requested or subpoenaed by the court. And therapists can be forced to testify even when it damages their rapport with their client. Who wants to be the therapist who causes a client to lose custody of their kids? You may not have a choice in the matter. And lastly, court-mandated or parole clients are also vulnerable when it comes to confidentiality. Therapists often have to report attendance and progress. And these sessions may be monitored even when clients are still sharing really personal information, which means a lot of these types of clients may feel the need to self-censor in order to avoid consequences. So given what we know about the limits to confidentiality and how you might be vulnerable as a client and a therapist when it comes to information you receive or share in session, how can therapists and clients connect on confidentiality so that trust is built, maintained, and everyone feels safe? Well, first off, it's the job of the therapist to be radically clear early on about what the limits to confidentiality are. This means spelling out what confidentiality covers and what it doesn't. Therapists can explain how records are kept, who can access them, and what happens in mandated scenarios. And it's important for a therapist to revisit all of these things as a client's life situation may change. But just because it's a therapist's job to lay all of this out and explain the limits to confidentiality, it doesn't mean that a client can't also do their due diligence and empower themselves by asking straightforward questions. Like, who will have access to what I say in here? Are there any situations where you'd be required to report something that I say? What happens to my records if I stop coming to therapy? Are you a mandated reporter in this state? And when therapists and clients co-create clarity, the therapeutic relationship gets stronger, not weaker. Transparency builds trust. And that's pretty much the basis of any ethical relationship. I'll be honest, when I started therapy for myself, I didn't know what the limits to confidentiality were. Sure, I read and signed the intake forms, but who really reads those things anyways? The point is, as a future therapist, I already know this about clients. So it's on me to make sure that I reiterate and reinforce what the limits to confidentiality are, because when a client's coming in with a serious mental health crisis, the last thing they're going to want to do is painstakingly comb through all of the fine print. So it really is on the therapist to reinforce these principles in order to ensure trust and credibility in the relationship.